Hi everyone, my name is Marty Pack. I'm the founder and creative producer of Wail of a Tale Productions. I'm thrilled to be here. Thank you for having us. I'm also thrilled to be a part of a community that's fighting for health and health policy to help victims of long COVID, ME/CFS, and a slew of other post-viral illness. Who are we? Wail of a Tale is not your typical media company. We are a documentary-driven 501c3 organization. So our expertise is in policy analysis as it relates to racialized and disparaged communities. All projects I have developed stem from a passion for bringing to life ways in which bad policy marginalizes communities. We explored the social and political determinants of health. My past work includes education policy and immigration policy as it relates to domestic violence. How did we get here? How did we start? The first week of shutdown, I was moving cross country from Ohio to Colorado to finish a second master's in public health. I took a job with my local public health department doing COVID investigation and education. The middle of 21, I kind of saw the trajectory of how our government was going to handle mitigation, and I was hearing and then started listening to people who were not recovering from COVID or recovered but then were sick again. And I knew we were going to have a problem. So we were embedded with the long COVID community from the beginning. And we have been watching the research over the past 4 years come out, and we all know what that looks like. Long COVID is a condition that disables and marginalizes communities expeditiously and impactfully. Long COVID is a perfect demonstration of what we know. Minorities and disadvantaged socioeconomic groups die. This is not hyperbole. Our docuseries confirms Black and Brown communities, LGBTQI+, working poor, Indigenous, and undocumented lack resources for their survival. It demonstrates a new way in which death of dismissed communities is being perpetrated. We established the need for radical investment in public health, education, disparaged communities, insurance coverage, and health care systems now. I'm going to show you some clips of women we have interviewed. The first one, Amanda is a Black woman and 19-year veteran as a nurse's aide for long-term and rehabilitation facility. She tells us a story of the neglect in nursing homes where she worked during the height of the COVID pandemic. She cared for 40 plus patients by herself and picked up a gentleman off the floor who had passed away while being neglected. While caring for these patients, she contracted COVID and subsequently became disabled herself for several years. Only due to her expertise in healthcare, she was able to advocate for herself and get the help that she needed and deserved.
I remember the day that I think I really contracted COVID because the DON, she was doing swab with the patients. And she asked me to help her with one resident. And when we went in there for her to swab him, he was fighting and he pulled down my mask. 3 days later, I ended up having to be rushed from there because my blood pressure was high, I couldn't breathe. And I went to Mount Carmel Hospital, I think it was June the 29th. They tested me for COVID, but they said I didn't have COVID. I had bronchitis. So they gave me 3 days off. At that time, I went back working there because, I didn't want to lose my income. I needed money, so I went back. And then July the 11th, I had to go to the hospital to get tested, and I was positive. It's very important to have a post-COVID doctor because dealing with all these other doctors, they're not gonna say that your symptoms was due to post-COVID. And if they're not saying that, then that can stop you from even being awarded to get paid, or to, getting less money, or not getting anything at all. And even though with me having a post-COVID doctor, they only gave me $15,000 because that's what my life was worth to them, $15,000. They ain't concerned about all the other health issues that I had to go through, and how I was off for 2 years, not being able to work, not having no income, the health issue that I still face every day. That wasn't put into consideration.
Demetria is a woman who was making 6 figures in a marketing position she had grown into with her employer. She was also one of the first heavy metal female fronts with her band Drench. Demetria was living a comfortable life with her family when they contracted COVID. Her husband and daughter recovered, and she was disabled. She is continually fighting to stabilize her health and has had access to the best doctors due to her employer's insurance, which continues to keep her alive. This proves problematic as she is surmounting the hurdles of the U.S. disability process. She can't walk, eat, or at times breathe. For her to qualify for disability, she had to give up the job she loved and the insurance that came with it. This is just one of the many financial and emotional hurdles her family is subjected to. While these challenges are frightening, the biggest emotional hit was that she can't sing and at times can only speak in a whisper.
When it was the masking debate, because it felt like, oh my gosh, like people that I thought loved me are okay with killing me, and I know nobody like actively thought like, oh, you know, we don't care about Demetria, so ha ha ha, we're gonna kill her. I know that that's not like the heart of most people, not all, but most people. Um, but it really felt that way. I think it was like around that time that I really dug into more of the mental health journey. I've been kind of every 4 to 6 months, it seems like I get hospitalized for a while and come into a downswing. And then I get back into that Metallica One video where I'm like stuck, not being able to do anything without coughing, and when I get into those points, like that's when, I feel pretty hopeless. And talking with my rheumatologist about, the hopelessness and, quite frankly, like suicidal ideation, which is not something that I even really knew about or understood before, but just that feeling of like, oh, my family would be better off without me. I know some people said that, oh, people with long COVID, they just are lazy. And, I'm not lazy. I've not been able to ever be lazy, but it's just not in my nature. So having to slow down, it's such a, and having to ask for help all the time. Like I like helping people. I don't like asking for help, and that's a pride thing, and it's a selfish thing. Um, and so having to be humble and having to be vulnerable and open myself up to ask for help and open myself up to say I can't do this by myself has been really challenging. And so just getting the counseling and the therapy that I need to be able to be okay with that, and to be able to not only be okay with saying those words, but to be okay with still loving myself and having to say those words.
It is our responsibility and privilege to share these stories. Thank you again for allowing us to speak, and we appreciate you all.